Everyone. It's a pleasure to be here, and we are going to do it together. Veronica, Mirna, Shil, and myself, trying to walk you through the initial CODI tool or CODI ideas, actually, or the systems assessment ideas. And I'm really challenged because it's a very challenging topic, and I never presented that tool before. So for me, it's new, even though I was part, together with Veronica, of the original team that started working on it back in 2012, right? And we were actually tasked to do something that will be light. I remember our superiors, our bosses were telling us, develop something light, because it takes more than a year to do an assessment of the system. And we are very frustrated. By the time we're doing an assessment, the dialogue has moved, the country has changed, we no longer know what it is. And the worst thing is that we keep on doing it one after the other. The World Bank is doing it, then UNICEF is doing similar assessment, then WFP is doing a similar assessment. So every year you have a new assessment, they all come up with different conclusions and recommendations. It's a mess. So try to come up with something that is more organized and more coherent. And I think we're still struggling with it. So even though we made some progress and we are going to share it with you, we are going to work with you on the key ideas for this and the principles that we collectively came up with. And still, I'm not sure we know how to do it fast, how to do it light, and how to do it in a way that brings everybody on the same page. And I'm going to share with you some ideas which we believe are key to doing such assessment at the system level. And Veronica is going to talk to you about core principles, something that constitutes our consensus view, our joint view of what such assessment is. And then we can discuss, because I still think it is very much a subject for discussion. As I told you, we are going to do it, 4 of us, but with participation of all of you. So ask questions, interrupt, or make comments. And we are going to try to do it for the first half of the day in the following way. So we are going to introduce you to what ISPA CODI tool is, core diagnostic instrument is, how it is different from a typical assessment, what we see as a value added of having this core diagnostic as opposed to other types of social protection systems assessment. What are the key challenges here? Then we are going to hear a presentation from Mirna about the experience of Philippines, how they did it, how they approach it, what is the current thinking of the government, how they want to use it. So it's a development story. It's a life story about one CODI application that seems to be very promising. In addition, I'm going to talk about some other applications in the countries. And we want to encourage you to see it as a journey, as an experiment, as something where you can use a really flexible instrument that can be fit to your country purposes, ideas, objectives, challenges. And we are here to support you, and I think we are here to form a kind of a network or community of practice that can keep on exchanging information about how we approach systems assessment, what is there. And I'm going to share also, we are going to share some lessons learned. In the second part of the day, in the second part of the morning, after a short coffee break, we are going to do a case study using the actual material, one of the applications from one country that did a full CODI application. And we are going to just focus your mind on one particular set of criteria among all of them, among 10, and for you to kind of play, it's almost like a role play of one element, one step in CODI application, so that you can appreciate the whole process. Our motivation there is to get over the apprehension, the fear that you might have looking at the body of CODI, which is very ambitious and very scary, and see that that is actually pretty feasible. And you can break it into pieces and actually do it. So that's the purpose of this morning exercise, 2 sessions. First, introduction, and then a case study or a group work on the case study that we will moderate. So that's the agenda for now. I'm going to focus on introduction to CODI, the conceptual framework. Then Veronica is going to talk about assessment criteria, and Mirna is going to illustrate how actually to apply. What are the steps of applying it based on an actual Philippines application? So it's really hard to read it, but you have the brochure, and the idea for coming up with CODI was really to look at the system and say, okay, what are the core principles? What are the main elements of system that needs to be assessed? What is the framework for approaching it? It's also a framework to collect information about a country social protection system. It's, if you wish, a checklist. If you are serious about doing an assessment of a system, what you need to remember. Of course, every country is different. Every country has its own approaches to social protection. Something is in, something is out. But what are the core reminders that you need to keep in for yourself? And it's also meant to be an exercise that not only is going to be joined with the government, but with all development partners. The purpose of CODI is really to be agency neutral and to come up with a common set of diagnostic, common set of ideas, and common sets of recommendations. So that is the ambition of CODI. This is where it is. It is a framework. It is a sample checklist. It is a core principles of looking at the system, what we know about what social protection system is and how it performs, but it's also a toolkit, a map for bringing different stakeholders together to the same page. What is the theory of change behind CODI? Why we are doing CODI? Or why we recommend countries to, among all of the instruments that exist to assess the system, to pay particular attention to core diagnostic instrument developed by Interagency Social Protection Assessment Group. The reason is that we believe that the systems need an improvement, and improving the social protection system is a complex process which has a lot to do with politics. And it's not in our ambition and it's not in our capacity really to influence politics. It's hard, right? The policy processes in each country are going according to their own logic. What can we do as development practitioners, representative of international agencies, government technical specialists, economists, social scientists, political scientists working in different agencies? What can we do? We can provide evidence. Evidence is the way to change or influence the policy-making process. That is really important then to come up with evidence that is not contradictory. So we believe by having a common framework for assessing, agreeing on key core principles, core indicators that are important for describing how the social protection system works, we can come up with a coherent diagnostic and therefore help the government to reach a consensus about what are the key strengths of its system and what are the key weaknesses of its system. So we did quite a bit of work in trying different instruments. You already seen it from Luz. So I'm going to talk a little bit more about where it was done and what I'm aware of. So you see CODI here is on the left, right? So the first application of CODI was in Philippines and in Vietnam. In Philippines, it's still ongoing, right? And we are going to hear from Mirna about how the process went and how it started and where it's going. In Vietnam, it's more or less completed. And in Vietnam, it was, in a way, a full CODI application, but it was done and it was meant to be in a very specific context, right? different parts of the government, different agencies had very different view about what social protection is. And there was a considerable amount of time spent to discuss about what is the social protection policy, what is the role of different agencies. So the rating was done, but the rating was done not to identify, not to come up with recommendations. The rating was done to see what are the elements of social protection system and reach a common understanding who is responsible for what. So application in Vietnam, you can call it application of CODI, but it was more to clarify the principles. Why social protection? Who is responsible for what? What are the elements there? What are the statistics to assess it? What are the key performance indicators? And the government said, you know what? We are going to rate everything in the middle. This is our starting point. Everything is set in the middle value. And then we are going to trace the progress. So that's a valid approach. That's one of the possible forms of applying CODI. Another application is in Belize. And in Belize, it was led by UNICEF and UNDP. Belize did really a full assessment. So they really literally applied whole principles of CODI to their own concerns, problems, challenges. Very specific focus there was on monitoring and evaluation systems, but it was a full application of CODI. We are using in our case study, a case study from Belize actually. And part of it, only part of it, small part of it, but it was a really impressive work. Report is really well done. We believe it's good. We believe it's precisely because in Belize the monitoring and evaluation system was not very strong. And the thrust of CODI was how to actually make it better so that it can be actually used to track the progress in the future. There is a lack of some statistics or indicators that we would like to see in the full CODI application. But beside that, it was a really good example, and we encourage you to look at this example. Saudi Arabia was an interesting example where the country itself is undergoing huge reforms. There is a review of the entire social policy, not only social protection, but also health, education, subsidy reform, the way how the public service is done, wages in the public sector, pension system, everything is under review. And the government saw this exercise of being very useful because Saudi Arabia has a lot of fragmented programs. Most of them are implemented by NGOs. So the government is actually financing the programs, but it's not implementing them. It's NGOs that are implementing them. NGOs are not very transparent. They're using the government money. Of course, they are sort of submitting their reports. They are subject to audit, but there is no common framework, no common monitoring system. So it was a very important for the government exercise to see what is actually there. And in order to do it, they selected largest programs and they did an assessment by program. There was no system assessment because Saudi Arabia is still struggling of coming up with the concept and with the view and the management of it as a system. It was, if you wish, a stage towards the system, describing the programs, individual programs there, what are the key strengths and weaknesses, how potentially they can fit together, but it was not really a system assessment. And we are going to emphasize how the system assessment is different from the program assessment. The key challenge for CODI is actually to do both, system and programs. And then the other countries that I'm not really aware of how they were doing the assessment, but there were a lot of attempts doing the assessments there. So I talked about the ones that are probably in a most complete form, that went through the review, that the government was really actively participating in it, sent the feedback, used it in their policy discussions. So these are examples of applying the principles of CODI to the full extent. So what are the other tools that exist? So core diagnostic instrument is meant to assess the system, the social protection system, against its own objectives, against what the government is saying the objectives are. So it's focused on clarifying What are the objectives of social protection as viewed by the country, as viewed by the government and the society, and then tries to move from it to the assessment, how well those objectives are achieved, how well different programs are working together, how well each program is implemented, and how well they are integrated through the subsystems, through the common information systems, through the common management system, local level implementation, monitoring and evaluation, and so on. So this is the view, right? So, but is it new? I don't think it's new. I think, and the way how I describe the history of CODI tells you that it builds on years and years and decades of doing assessments in different agencies. Yesterday, you've heard from Sri, and Social Protection Index, if you wish, is a way to assess the social protection system performance, right? There were other assessments that were done by the World Bank. We do social welfare assessments, sometimes it's social protection assessment, sometimes social assistance. We look specifically at social assistance or social safety nets, and we try to come up with the assessment of this. Another whole new area of analysis of social protection systems is social expenditures. And it's done very often in consultations or jointly with the International Monetary Fund, where we look at the different social programs, pensions, social assistance, social services, labor market programs. We try to assess how well they are financed and how well the budgets are executing. The focus there is how orderly is the process of budget planning. Are they budget planned in a realistic way? Are they executed the way they are planned? What is the feedback from execution to the next year financial planning? This is the focus of this budget management or financial fiscal management perspective on social protection system. Truly important, but again, probably just a lens, just a specific angle to look at what social protection is. There are also some specific analysis. We are doing program level analysis whenever the country is asking to help to improve a particular program, let's say flagship program, CCT program, PKH in Indonesia will be examples, or 4P Pantawid Familia program in Philippines will be another example. We'll look at the different aspects of implementation of that one program. And we do what is called process assessment, when we look at how the business processes look like, how the program is staffed, how it works with the beneficiaries, how it raises awareness, how inclusive it is, what its performance, is it covering everybody who is meant to be covered, is it paying transfers on time, what are the perspectives for people to improve their living standards within the program, and so on and so forth, right? Then we also do impact evaluations. You've probably seen lots of impact evaluations. By our latest count, there are about 400 impact evaluations in the world, in the developing world, done on different social safety net programs, right? 400, it's a lot, right? And each scientific impact evaluation involves running a specific survey, sampling beneficiaries of program, sampling similar people who are not in the program, comparing how they're evolving over time, seeing what the program is doing to their welfare. Again, another lens, another way to look at how different programs perform. And there are other tools as well, right? So CODI is not the only way to look at the system. We are going to look at the following days at SPOT, the new instrument that is meant to look at the social policy, social protection policy in general, and look at the policy formulation process, definitely part of the system functioning and system assessment. We heard already about the Social Protection Index that can be used in CODI, or it can be a separate assessment of the system. We heard from PEEP about Aspire, and Aspire is the World Bank Atlas of social protection indicators for Resilience and Equity. This is the abbreviation. We love abbreviations. So this is one of those abbreviations where we try to combine indices, information about performance based on the survey, based on administrative data, just trying to document. And it's still work in progress because we are still struggling with coming up with a full inventory of social protection programs, interventions, their financing, number of beneficiaries, who are the beneficiaries, what is the profile, how it evolves over time. We also know about the sort of very systematic initiatives, international initiatives that exist at the international level, supranational level, which try to harmonize the social protection data. And in Europe, it's SPROS. It's a very interesting way to classify social protection programs and track their performance over time, collect systematic information about their institutional setup, about their implementation, about their budgets, about their impact on key welfare, social welfare indicators. And it's SOX, which is the OECD database that is meant to collect information from OECD member states about their social protection spending and beneficiaries of social protection. So a lot of initiatives, but as you see, it's unfortunately as Pete presented yesterday, right? Remember this graph where he was describing coverage of the pension system and level of income. And it was an upward sloping line. The richer you are, the better information is. The better is understanding of what social protection is. The better it is embedded in laws and regulations and understood by the people. But that's precisely the problem, because the less wealth you have, the more poor you are, the more you need social protection. So all this information, all of these initiatives are kind of missing what is the main development challenge. Develop social protection systems where the needs are the greatest in countries which are the poorest. So let me then walk through again the main elements of systems assessment as presented by CODI, as documented in CODI. So CODI builds on all of these initiatives work that was done and was trying to come up with something, I come back, simpler, lighter, easy to implement in a shorter period of time, right? And what was deemed to be essential in all of these different ways, complicated ways to look at the social protection system, what was the nutshell? What was the core elements? First core elements was mapping. It's impossible to describe the system without actually having a good understanding of what exists in the country. What kind of social protection programs exist there? And it's almost like chicken and egg problem, because you can come up with a system of classification and tell, this is social protection, you count this as social protection, this is education, this is health, this is something else. That is not the way how the world works, right? Countries define social protection in the context of their political dialogue, social contract, and it's always different. So it's really important to understand how social protection is understood in the country. So it is a dialogue, and then based on this understanding, map various parts of it. What is actually done, what is implemented, what is counted as social protection. Then it's important, once this inventory is done, and we already see the architecture, we see the building. This is what it is. Then its building is doing something. Its building is there for certain functions. And to assess the functions, it's important to look at the performance. So the performance is becoming the core tool to see how the building is functioning, how resilient it is, how effectively it accommodates what is expected. And this is done through the performance criteria. Performance criteria is crystallization of what we know about what matters in carrying out key social protection functions. So that's the core of CODI, is performance criteria. Then based on assessing performance, and assessment of performance, as we are going to see, is not entirely a technical process. It's not like you have a certain level of indicator and you say it's good or it's bad. As we heard yesterday, and that is a critical difference with Aspire, which is all about ranking different countries, or Social Protection Index, which is again about ranking countries. In case of CODIs, we are saying we are not ranking countries. We are trying to come up with own performance criteria which are based on the consensus within the government, between the development partners, key stakeholders about what is happening there, how well it is working, are we satisfied with it, or it can do better. So it uses a lot of local knowledge that no outside expert will have, and statistics are not able to convey it. So that's why it's tricky, it's complicated, but at the same time it's so much fun, because it's this unique way to surface this knowledge that exists in the government, in various agencies, and bring it together in a simple and coherent framework. So based on that, there is identification of policy, program, implementation, strengths and weaknesses, and based on that one can come up with recommendations. Recommendations may be part of the process of CODI, or it may be done separate from CODI. What's important is CODI represents a consensus view of what works well, what should be improved, what is unsatisfactory and needs to be improved. And then, because everything is done, as I described in the dialogue, meant to be done in the dialogue, it's not done by experts, it's not done by research institute somewhere in isolation, it's not based on statistics or past data, it's a live policy dialogue. It's the way to promote exchange and core coordination just by doing that. It's the platform for doing it. So how CODI is described in social protection system. We see it as the way to codify, so CODI codifying, right? What matters, what are the elements? And unfortunately, it's too complex to my taste, and this is my opinion as a researcher, not as the representative of one of the agencies. It's still way too complicated. So we probably can simplify it further. Because now we have 3 areas. These 3 areas are absolutely necessary. I don't think we can look at the system without looking at 3 areas. And those 3 areas is policy. Policy includes governance, legal framework, policy-making process. It's programs, and we are talking about programs design, how they are designed, what is the level of benefit, what are their objectives, whom they are meant to cover, what is their theory of change, what they want to achieve, how they are financed, what is their budgets, how many people working on them, implementing them, design, right? And implementation. Implementation is a business process within each program. What is the administration of each program? How the checks and balances, roles and responsibilities are allocated? How well the benefits are paid? Are they paid on time? Are they not paid on time? How the audits work? How the grievances process work? So these are all the elements, and each of these areas are broken down into what matters for policy. As I mentioned already, it's legal and policy framework, it's a policy-making process itself, it's what are the needs for social protection, and how well the policy process is capable to reflect those needs. But it's also implementation capacity, it's financing, it's monitoring and evaluation, and it's also policy dialogue within the country and awareness about social protection among different stakeholders. I already talked about design, which is very simple. I think in design we managed to nail it down to a really small set of things. And you, of course, know what is eligibility, what is benefit design, how you finance those. One important thing here is incentives, something that we often forget. How these different designs affect behavior. What do we know about behavioral impact of these programs on the beneficiaries? And in the implementation, we are still defining how to name those different buckets, but in principle it's clear. It's moving from raising awareness, outreach to people, making sure everybody knows about programs, making sure we're enrolling all people who can potentially benefit, eligibility determination, who is eligible, who is not, why, and what to do with people who are not eligible, then delivery of actual benefit, and it can be transferred or services, equally important. It can be in kind or it can be in cash, right? And finally, how you handle the monitoring, the compliance, the grievances, how you are making sure that people are accurately identified and served in time and according to the principle of the program. So these are the elements: policy, programs, implementation. Each one has element. And we are coming up with 18 different things, right, to look at. 18 things is a lot to look at. Now, even more complicated, this is the architecture of the social protection system. So you have the policy level, which is the roof, right? The policy is the roof. Then you have pillars, and those pillars can be different. We at the World Bank traditionally organized everything into social assistance, social insurance, labor market. It can be different, it can be functions, right? ILO is using 9 functions to understand what are the key vulnerabilities and risks and how the different programs can be aligned there. Or a country can choose its own. For example, in Philippines, there are 4 pillars. There is social welfare, there is social safety net, which is disaster response, social insurance, and labor market and activation, right? So each country is deciding how many pillars. But it's important that it's not like all programs are equally spread, right? They are organized in clusters. Organizing them in clusters helps to think about what is relevant, what are the important elements of social protection, how, if you wish, over the life cycle, people are covered by different social protection, or what is the mapping to needs. You have needs, you have programs, how the programs are mapping to needs. This is the way to map the programs to the reasons why social protection is there. But then, at the primary level, at the foundation level, that is the foundation, you have individual programs. And within each pillar, you have multiple programs, right? So one thing you are doing, you are starting CODI by looking at all of the foundations, everything that is there, all of the elements of the foundation, you try at least to describe them. Then, based on that, you see how they are organized in pillars. And then you select from some of these pillars, some of these programs, the ones that are the most important ones to understand in depth. And you look at their implementation. So implementation, the focus is at the program level. You select several programs. You cannot do all of them, right? We heard yesterday 120 programs in Indonesia, if I'm not mistaken. The statistics was given. We just did with our colleagues in Russia a review of the full inventory of programs that exist there, 11,000. Right? You cannot do assessment of 11,000 programs, right? Unfeasible, impossible. Average for the developing world, 40 programs, right? We found that 40 programs only in social assistance area, plus there is pension, plus there is labor. So you say easily about 100 programs exist in each country. Impossible to look at each program in detail. You will spend exactly a year or 2 or 3 in trying to describe how they are implemented. So it's important at this stage to select some representative important programs and do implementation assessment on them. But then you look at the program pillars and you try to understand design, how they are designed, what are the principles of design, and what is their performance, how well they are performing according to their own objectives. And then you go to the policy level, and there you discuss about the governance, about how well the policy implementation process itself is running. So the assessment is complicated, right? It's trying to take the whole architecture from the implementation level to the program design level to the policy formulation level and try to come up with a coherent view of the entire architecture of the building. That is where the challenge is. This is why it's complicated. But at the same time, it's probably unique, right? Because we keep on saying each program does not exist in isolation. Each program is related to other programs that exist there. The main challenge is coordination. The main challenge is fragmentation and the need for closer coherence between the different programs. That is the answer to this, is actually looking at the entire architecture of the building. Now it's the time for Veronica to walk you through the core of CODI, which is the criteria and what they represent. What is, to our joint view, is the key thing that determine social protection.
Thank you. Okay, I'm a little bit concerned about time, so I'm wondering how we can do this quickly. But allow me to first have a quick look as to whether any of you have posted any questions. I said in the beginning, how do I exit this? That you can submit questions through the app. No questions. So if you have any questions, we can have a quick session now, or you can post them on the web. And to get started on this introduction on the CODI criteria, I would like to do a little thought experiment. Now, imagine your country has just passed its national strategy for sustainable development, and you're an advisor to the government. A key aspect in the national strategy for sustainable development is that social protection has been identified as one of the accelerators to fight poverty. So if you're now the government advisor to the government tasked to improve the social protection in your country, what would be the areas that you would look at? And what indicators or criteria would you come up with to say, this is how in our country we can use social protection to accelerate progress on preventing and fighting poverty? So you can post this either through the app, instead of posting questions, just quickly throw out an area or a criteria, something like, you can just say financing, or you can just shout into the room or show your hand and say something. What would you start with? What would you look at in your country if you were asked, how can we improve social protection to fight poverty? What indicator, what criteria? So we just had a question asked. Do you think this tool can be made simpler with more visualization in the future? I mean, I have an anecdote to share about this question of making the tool light and simple. I mean, it is true, if you open the tool, it could seem overwhelming, but as Ruslan explained, in a way, social protection systems, as a system analysis, social protection systems are complex. It's not, I mean, it's not something that, in a way, can be done really super easy, super quick, and super simple. Having said that, of course, there are a lot of ways that CODI could be made more user-friendly, and we're working on that. But I think it's also a way of how you approach this task. If you look at a country with 11,000 social protection programs, you probably have to be a little bit pragmatic and strategic about what you look at more in depth and what you look at more cursory. Having said that, if you look at an average of 40 to 100 programs, it sounds more manageable, especially if you have good administrative record keeping. If each program is well managed and you have the information that you need readily available in annual reports, it shouldn't be too much of a task to look at 100 progress or implementation reports and take out the key information and indicators that you look for in terms of coverage, benefit levels, etc. So it is also a question of how well a country can, or a government can force the program administrators to do good record keeping. And the anecdote I wanted to share about the Philippines was actually, They opened the questionnaire, they saw, oh, actually the questionnaire has something like 600 questions. You must be kidding. We're going to go through this and we're going to tell you what to throw out and what to keep. And then it's 600 questions across the 18 key areas. They looked at it and then they said, actually, we think all of these questions are really relevant, and in some areas, could we actually add a few here and there? So, I mean, it becomes manageable once you break it down into the different areas, and you can have a team of experts, of course, look at that. It's not like a single person sits down and answers them one by one. It's, as I explained yesterday, it's a repository of questions that you can look at if you want to analyze a certain area, to just make sure you don't miss on anything, the checklist that Ruslan was mentioning. Okay, so any thoughts? I hope you were able to listen to me and at the same time reflect on the criteria that you would, or indicators that you would look at. We've heard a few indicators already in the presentation that we had yesterday from Sri and from Pip. So what do you think are the key criteria to assess the performance of a social protection system? Any thoughts? Or did I lose you?
Hi, thank you for the presentation. So I'm not sure about how correct is my answer or maybe the question, but in case of Pakistan, I would say for me, because I'm working for the social sector overall, in Pakistan, the most difficult thing that we are facing these days in terms of vulnerabilities is the women health and child health. So I would, maybe in case of Pakistan, if we have to provide the social protection, maybe it's the health department first of all, because we are facing the indicator, for instance, the infant mortality rate and child mortality rate and stunting all above is very, very high, which actually leads that mother and child health is maybe in terms of social protection and strengthening the health department may be the priority. And so maybe.
Yeah, health is often ranked as the key priority in a lot of countries. Can you be a little bit more specific? What, I mean, when saying we would look at health, what, I mean, infant mortality would be one indicator to look at, or, I mean, is there anything else?
Maybe the infant mortality, and number two, the stunting is very high, because the burden of disease is very high once they grow up, and so maybe the food and nutrition department maybe can play a role in terms of social protection by providing in-kind supplements to the pregnant women or maybe the newborns. So this seems one of the priority area in case of Pakistan.
Okay, great, thank you. Anyone else who has an idea on criteria to look at for the performance of the social protection system? Okay, so maybe I'll start with an overview of the criteria that the interagency team working on the CODI tool came up with. So this is the list, and I'll explain each of it in a little bit more detail. One key indicator that we have seen a lot of information on yesterday is coverage. I mean, who are intended target groups and who actually receives benefits. The second criterion we came up with is adequacy, and unfortunately that's something that's already more difficult to measure and not so often included I mean, I think the social protection indicator of the ADB, it has this benefit level in it, but for example the SDG monitoring indicator, it doesn't have a notion of the adequacy of the benefit levels. It only looks at how many people are covered. It doesn't look at are they covered with sufficient level of services. Then appropriateness, I mean, it sounds very vague, but it looks at whether the benefits and services are actually addressing the needs of the population. Respect for rights and dignity, something very important to ensure that what exists on paper can effectively translate into practice. Governance and institutional capacity, of course, I mean, a lot of these things are very general. I mean, every policy area, you need good governance, you need the adequate you need the adequate institutional capacity, but obviously it's also true for social protection systems. Likewise, financial and fiscal sustainability. Coherence and integration, we've heard a lot about that this is one of the key issues that the ISPA tools are trying to address and very good at solving, to improve policy coherence and integration. Responsiveness, I mean, schemes or programs and the system in a whole needs to be flexible and responsive to demographic developments, but also to sudden shocks and crises. Cost effectiveness and incentive compatibility. So these are the 10 criteria that we came up with and that we are going to look at in detail and also work on in the second session, where you look at where you get an exercise to work on the example of the Belize application. So when you look at these 10 criteria, you will notice that, I mean, in terms of this levels of analysis that Ruslan was speaking about, some of them seem to be speaking more to the program level, and some of them seem to be speaking more really at the system level. And what I would like you to do as we go along now, think a little bit about, is this a criteria that speaks to the program, or more to the system, or equally to both? Now, the definition of inclusiveness that we came up with is that the social protection system should guarantee that everyone is protected along the life cycle. That doesn't mean that everyone gets benefits. It just means that if you need, you have the protection. And if you are in need, you can access benefits and services, but it doesn't mean necessarily that the benefit has to be universal. Including the poorest and most vulnerable, and in order to reach the poorest and most vulnerable, it is important that adequate attention is paid to issues such as non-discrimination, gender equality, responsiveness to special needs, and de facto accessibility of programs and benefits. So this is a very complex definition, if you want, of coverage, but it's looking at effective coverage. It's not everybody above the age of 75 is intended to get a benefit for a social pension. It is, how can we ensure that really the people that are targeted through a social pension will get it? Can I see a quick show of hands? Is this a system level indicator, or is this a program level indicator? Which level do you look at to measure adequate coverage in the country? Who thinks it's a program level indicator? Okay, who thinks it's a system level indicator? Who thinks you need to look equally into both? Okay, some people are showing their hands at several things, which is fine. I mean, obviously, you're collecting the data from the program level, but you can only assess whether the system realizes coverage by looking at the aggregate of the information that you've collected from the individual programs. If you know that one program covers 3% of the population 70 and above, you don't know what's the population coverage. If you know these are like, this is the social pension, this is the contributory pension, these are occupational pensions, and you add those up, then you know, I don't know, 60% of the population 70 and above is covered, and you have a coverage indicator for old age pensions, for example. So in the assessment matrix, or overview of findings, for inclusiveness, this would then be broken down, following the definition that we've just seen, into certain sub-indicators, if you wish. So following from this, we need to look at gender equality, non-discrimination, and special needs. I'm talking about the very left column now. We need to look at effective coverage. What is the number of people that actually get something? And we need to look at accessibility. Is there any obstacles or barriers for people to either register with the program, or if they are registered and enrolled and entitled to benefits, can they actually get them, or is there any factor that inhibits them from getting what they're supposed to get. Okay, I have 5 minutes left, so I need to speed up a little bit. I briefly talked already about adequacy. This mainly speaks to benefit levels, but we also need to make sure that for the adequacy of the system overall, but also of programs, is that benefits are paid regular and they are predictable for the households that receive them. So even if you have high benefit levels, if a program intends to pay benefits every 2 months, but then de facto the household only receives them very sporadically, sometimes every 3, sometimes only after 6 months, is not an adequate provision of benefits. And this story becomes even more complicated when you look at the delivery of services, which are an important part of a social protection system. And we've just heard from Pakistan, health is typically a key concern. And they're, of course, supplying adequate quality and accessibility of health services. It's even becoming more complicated. Appropriateness, sorry. Do we want a quick show of hands? Is this more a program level indicator? Who thinks it's more program level indicators? Adequacy? No one, very good. Who thinks it's a system level indicator? So who thinks it's both program and system? Okay. I mean, in a way, for adequacy, it's the same story. Obviously, you need to look at individual programs for the benefits and services they supply. But whether the total package that a household receives from the different programs is adequate at a household level is then a system level indicator in terms of the entire performance of the system. Appropriateness looks at whether the system is able to address the needs of the population. And this means that you need to look at the combination of schemes and programs available. Do they cover the different different groups in society, for example, along the life cycle or across different risks, in a way that everybody is adequately covered. So if you look at the combination of schemes, I think it's pretty obvious. This is a system level indicator. I mean, there's no way you can assess the appropriateness of addressing people's needs unless you look at the combination of schemes that are available. Respect for rights and dignity. This is, in a lot of countries, this is a big challenge. There is a tendency to run social protection programs without necessarily anchoring them in national law and legislation, or to have the decrees and regulations that would operationalize them properly. But this is something that's very important for the system's sustainability, and it's important also for the population that they have rights-based entitlements that they can claim. And if they feel that they're not treated adequately, that they can also complain, or that they have a place where they can appeal certain decisions, so that overall the system is run transparent and accountability. It's also important for accountability mechanisms to avoid discretionary allocation of benefits, for example. I don't want to say too much about governance and institutional capacity and not a lot about financial and fiscal sustainability, because these are actually the two criteria we're going to cover in depth in the next session. Coherence and integration we've also heard a lot about already in yesterday's presentations about the need for policy coordination. This is always important for policy making, but it's particularly important for social protection, that is inherently a multi-sectoral policy domain. You have a lot of different ministries involved, And if you look at the questions that we've collected from yesterday, this is one of the most often asked questions I think we have on the board over there. How can we improve and ensure adequate coordination and coherence across different government ministries and agencies and sectors? So this is, in a way, it works at two levels. How can we show coherence and coordination, for example, between employment policies and social protection policies? But it also works internally. How can we ensure coherence between different social protection schemes and programs? Responsiveness, I've already explained this quickly. It's really about ensuring the system is flexible to react to changing needs that arise from many different sudden shocks or longer-term developments. And cost effectiveness, this is something that's also very complex and challenging to assess. And when we drew up this list of criteria, it was actually developed as an optional criteria. Because most likely, within the scope of CODI, it's important to run a new cost effectiveness analysis, fully fledged. But if there is already existing cost effectiveness analysis that have been carried out previously in the country, it's important to integrate those findings in the CODI narrative report and in the CODI analysis you're carrying out in the country. And likewise, incentive compatibility, it's an optional criteria. It is important, but it's also complex to measure. And just quickly to mention that for incentive compatibility, it's important to not just, there's often in the discussion of social protection, this concern, if we give too generous benefits, people will be discouraged and become lazy, and a very patronizing attitude saying too generous benefits may give disincentives to work. But when you think about the incentives that a social protection system generates, don't just look at the beneficiaries. It's important to also have adequate incentives for employers to register the workers and pay the contributions that are due. And this is a challenge in a lot of countries. There's a lot of evasion, both from the workers but also from the employer side. Likewise, the tax authorities need to do their job. They need to collect the required contributions and taxes. The social protection service providers need to provide good services. And beneficiaries need to know their rights, and they need to register with programs and take up the benefits that are being offered. So incentives work on all levels and are important at every step. Okay, how to apply CODI? I think this is something we will look at in the next session. So I'm going to do this as a start of the next session, and I would rather quickly switch to the case study of the Philippines now, so that we have a chance to at least okay. Let me see in the meantime whether there have come in any new questions, and then so Sheila, are you starting or is Mirna? You're going to give a quick introduction, and then we. There was this one, right? So if you want to come up already, then.
Yes, good morning everyone. So what I'll do is I'll just quickly give a background of how the engagement of the Philippine government on doing CODI started, and then I'll quickly hand it over to Mirna so she can talk more about the experience at the country level. So, right, so as Ruslan mentioned, so the Philippines is one of the participants as one of the pilot countries that participated in the fielding of the initial instruments for the CODI, for the core diagnostic instrument for this assessment, for the ISPA assessment tools, and that was in 2014. So, but let's backtrack a little bit. Before 2014, actually, the Philippine government already started working on their own social protection framework and social protection definition. That was way back in 2007. So they adopted the first definition of social protection in country and framework in 2007. And quickly after that came the financial crisis, the FFF, financial crisis of 2008 and 2009. So it was a very quick realization for the government to quickly assess the initial understanding, initial concept of social protection in the Philippines. So what they did was to quickly launch their own internal assessment of current existing social protection programs at the country at the time and the initial framework that they have for social protection. So they did that in country. It was a mix of analytical desk work of available programs at the time, but also combined it with consultations with stakeholders and other implementing agencies, not just the biggest implementing agency of social protection at the time, which is DSWD. So they had their own process, which is more or less similar to the process of CODI. And that process actually led to more elaborate, more detailed articulation of an SP framework for the Philippines. So in 2012, they adopted a new, or what they call an enhanced social protection framework, which was basically a product of an internal review of the own SP programs and SP system at the moment. So that was 2012. And then soon after, and then around that time, it was around that dialogue of the new social protection framework in the Philippines that the CODI instruments are also being developed. So around the spring meetings, I think, of 2013, it was then that the World Bank offered this new developing instrument to the Philippine delegates at that time. And the government delegates, it was a very, very appealing instrument to them at the time because they were just starting on a new framework. So they saw the CODI as an instrument that they can use for, first of all, a periodic review of a system, of a social protection system that they knew had to be reviewed periodically and enhanced through the whole engagement of government on social protection, but also they had to do it in a systematic manner. So the CODI instrument looked very appealing to the government at that time, and that was the interest in coming up with a country report for CODI. They wanted the country report for CODI as a demonstration of how the instrument is actually being used, and so that they can use it for their succeeding future assessments of their own system internally. So what they want, what the interest really from the government is the instrument of the CODI and how they can apply it using their own internal systems after an initial demonstration of the World Bank and other partners at the time. So that was the background. And then I'll quickly turn you over now to Myrna so we can start discussing the whole experience of the Philippine government. So Myrna is a director at the Planning Ministry of in the Philippines. It is the National Economic and Development Agency. So that's mainly the partner agency of the Social Welfare Department. We have a subcommittee on social protection in the Philippines, and it's being co-chaired by the Planning Ministry, where Myrna is heading one of the divisions, and also the SWD. So Myrna will share with us now the experience of the Philippines on the CODI.
So, good morning, everyone. So, when the Philippines became a pilot of CODI in 2012, together with the Vietnam, it was a very exciting period during that time because 2014, I mean, we just experienced Haiyan during that time, and also there were various reforms being implemented in terms of planning and budgeting. We were moving into results-based, outcome-based budgeting. That's why the CODI approach was very appealing to our high officials. So for this presentation, I will focus on the process that we have undergone. But as you saw earlier, while Vietnam completed the report, the Philippines did not. So there were no application at the policy level and no assessment of the impact. But it became a very useful tool since 2014. But I think we have plans to complete the report, and there are also avenues now wherein we can apply the results of the CODI assessment. So these are the officials of the Philippine government during that time. So you have the Secretary of Health, who is leading our Philippine Health Insurance, the Socioeconomic Planning Secretary, and also the Secretary of Social Welfare and Development. And at that time, they were meeting every month. So interaction between these agencies are very dynamic and regular. And for the CODI, we also engage other agencies like our government's health insurances, social service insurance, and also the Department of Labor and Employment, because as Sheil already said, we have already established our social protection framework covering 4 elements of social insurance, social safety net, social welfare, and labor market information. So we have 4 pillars of the social protection system. That's why there were meetings between World Bank officials and key government agencies in social protection. And also during this time, we already established our subcommittee on social protection, which is under a president-led bigger social development committee. So we were basically headed by the President of the Philippines. So there's a very high personality leading the activity or the engagement between various agencies. So the consultations basically were between World Bank officials in Washington and the key technical people in the Philippines and Vietnam. The consultations basically focus on the questionnaire and the process that had to be undertaken. So when the questionnaire was more or less approved by the technical people, the distribution or filling up of the questionnaire was distributed, and since we already have the subcommittee on social protection, it was very easy to disseminate and also to provide the information on how to fill up the CODI and how the CODI process would be undertaken. But again, most of the interaction were basically from the Philippine government and officials in Washington. So you can see that you may imagine that while in the Philippines, there is a committee that is heading the collection of the information. What happened was that we just submit these inputs to the officials in Washington. And later, communication were between emails and phone calls. Okay. So again, this is 2014. Many things were happening in the Philippines. And the social committee, you can imagine some other agencies or some other institution setting up their own social protection committee, because these were the Haiyan days and also the transition to Bangsamoro in southern Philippines. So we were fast-tracking the Bangsamoro law, and the requirements were very high, especially in terms of provision of basic services and social protection. So, while we did not finish the report, and there were lessons learned, The recommendations from the experience have already been provided or incorporated in, I think, in the refinement of the CODI process. So first, we really want the questionnaire to be shortened, 600 pages of questionnaire, and at least, I think for the Philippines, when we were setting up, when we distributed the questionnaire, it involved more than 10 concerned agencies. So, and at that time, while there were redundant items, they were not deleted, and some questions or information were not relevant to our to the country. Then it became evident that in the process there is a need to establish an institutional mechanism for the coordination of the CODI process itself. While there is a subcommittee participated in by various agencies, there is a need to set up a more technical level coordination in order to facilitate the CODI process and to ensure timely submission of the inputs to World Bank. And also, the institutional mechanism is also required to later to get ownership, national ownership of the report. So when we submitted the report to World Bank, we just waited for them to provide us the report. And basically, if we do that, the document is really not a Philippine government report. And the institutional or this committee will also set the timelines. It should set the timelines in order to produce the report on time and the results be applied timely also. So, okay. So in terms of sustaining the technical assistance from the development partners, I think it was not only World Bank that provided assistance. I think we also have there's a parallel activity going on at that time. We had assistance from the ILO. At the same time, CODI was in the process of being implemented. A parallel activity on the ABND, the Assessment-Based National Dialogue, is also ongoing. But the ABNDs, while the CODI is focused on the system of social protection, ABND was focused on specific programs and projects on social protection. So I think that's why the agencies were able to provide the inputs, and I think the format of the ABND was more manageable for the agencies. So other issues that crop up was to provide regular updates on the CODI instrument, because I remember in 2014, we were one of the pilots. So the process was not yet that established, and also the instruments. There's also a need to provide budget support for certain consultations and to assign a focal person from the Philippine government, of the Philippine World Bank country team for easy facilitation. So we were not going through the Manila World Bank country team, but we go straight to the World Bank Washington team. We also think that there should be a need for wider consultation workshops among different stakeholders like the government, the civil society, the private sector, and the academe to really provide more inputs to the CODI process. And at present, we also want to present the results of the CODI, since the process and our participation in the CODI process was approved by high officials. We also want to present the results to them. And one policy-making body is what we call the Social Development Committee. This is a high-level, cabinet-level committee. So while the report was not finalized and it is being updated now, we see that the report will serve as an input to the 5-year social protection plan in the Philippines. So every administration, while we prepare the Philippine Development Report, which is the National Development Plan, there are sectoral programs or plans and programs that are being prepared. And one is the 5-year social protection plan for the Philippines. And for the present administration, we have the 2017 to 2022 Philippine Development Plan, and this will be updated in 2019. So the results of the CODI would be very useful inputs for this updating exercise. Also, we see, as I said, that the CODI shows you an assessment or a diagnostic of the social protection system as a whole, and it will complement well with the assessment-based national dialogue that is being prepared now. We're expecting the report to be released in April. And another activity or another important activity that the Philippines will be undertaking is a high-level interagency consultation on social protection, because we wanted to revisit our social protection framework. We formulated the framework in 2009 and updated it in 2012. So we think that it is high time to revisit the framework, and we will be conducting a high-level interagency consultation come April. So we hope that the CODI report would be available by then. So that's all. Thank you.
Thank you, Mirna, for this exposition. So as you've seen, we've chosen a really complicated case, right? And that complicated case for us is an immense source of lessons. So let me walk through a little bit this process and see what's entailed for us here. The first thing, the first lessons we learned is the reason why you are all here, right? The application of such instrument, the assessment, needs so much information. I talked already about the system, that nobody who is not embedded in the country, who is not part of the policy dialogue in the country, cannot do the assessment. So that is the hard-learned lesson. That's why we are giving you the training, because you can be an agent who can implement such an assessment, right? You can rely on external bodies. Yes, we learned the lesson. Mirna mentioned 600 questions. If you look now at the CODI guidance, it's 200, right? So we eliminated 400 questions, and we can eliminate even more. So that's important. So one, simplification, great experience, learning from each other. The second one, learning that it has to be country-owned process, precisely as Mirna is saying, and we see gradually this country ownership developing. In the case of Philippines, incredibly useful and promising development, which will lead to the completion of the report. Second question, and that is what Veronica is going to walk us through after the break, is that questionnaire is not the way to start. It's not the main thing how you do CODI assessment. Questionnaire is a facilitating device. And we made a mistake by focusing on completing the questionnaire. So we came, a big interagency mission came to Philippines. It was GIZ, ILO, World Bank, other agencies that were local joined us. We discussed with the government. We say, okay, we agree that this is an important exercise. Let's do it together. Here is the questionnaire. Fill it in. And the complexity of the system in Philippines meant that it went to 10 different agencies. Some agencies were fantastic responding to the questionnaire, right? DSW provided immediately all of the responses. GSIS, which is the government pension fund, was not communicating. So we keep on having a gap on information. What can we say about the pension system in Philippines? We don't have enough information. The pension funds do not seem to be responding. We don't have our information ourselves. So we decided, okay, we need to do a pension system assessment. So our colleagues went and did a pension system assessment. It took a year to actually fill in all of the information gaps. So without waiting for the questionnaires to be filled. Right? Then, if you look at the labor market, right? Labor market in Philippines, the Department of Labor and Employment, is a myriad of programs. It's a very complex system. It's a system in itself. And again, filling in the questionnaire was so complicated for our counterparts, and we were waiting for the questionnaire to be filled, and it was this back and forth. Again, why we were doing the filling of the questionnaire? Why was not going to the agency and doing a consultative process by trying to assess this complex system? That is the lesson learned, and Veronica will try to walk us through how to properly use the questionnaire in its new simplified format 1. And second, we are going to do at the tables this exercise. Okay, you don't have all information you need, how you can overcome the gaps and still do an assessment that is shared and that is consensus building. So these were hard-won lessons, and we believe that exposing you to this real complexity of doing CODI with real agencies, with really complicated, well-developed, sophisticated system that has complex governance structure is something that you can probably learn from and employ in your own countries. So probably now we can make a break.
Yeah,
or
I
Veronica
think we have
has
5 minutes left. So if there are any questions or anything you would like to share.